Gentleman yields back. The chair now recognizes the gentlewoman from Massachusetts, Ms. Presley, for 5 minutes. Okay, we'll try to pick up that later. The chair now recognizes the gentlewoman from Illinois, Ms. Kelly, for 5 minutes.
Thank you, Mr. Chair, and I too wanted to thank Chairwoman Maloney for all of her work on this committee and wish her the best in her next chapter, and also wanted to thank Ranking Member Heiss for all the work that he's done, and as he moves on to his next chapter. You know, it's interesting being here today when yesterday we were celebrating because of the legislation that was passed, and now we're here today talking about a topic that's so very sad, and we're also talking about it on the day that 20-something people were killed in Newtown, you know, so around the issue of guns. And I do agree with my colleague from Wisconsin. When we talk about crime, we need to get to the root causes. You know, we can, and I'm a big gun violence prevention person, and I'm for the legislation, but we can talk about the legislation, but unless we do something, you know, around prevention and investing in all kind of communities and all kind of people, and especially all kind of young people, you know, we're going to find ourselves in the same place. So I want to also thank all the witnesses. LGBTQI plus people across this country have historically experienced health and economic inequities, largely rooted in lawful discrimination against them in medical settings and employment. For example, men who have sex with men continue to face discrimination in healthcare settings because of stigma against HIV that has persisted for 4 decades. This stigma is damaging and humiliating. According to a 2021 study from the Kaiser Family Foundation, LGBT people are more likely to report negative experiences with healthcare providers, including being blamed for their own illnesses and negative health outcomes. Analysis from the Center for American Progress showed that almost 10% of LGBTQ people report being turned away from healthcare facilities because of provider discomfort. Dr. Meyer, can you explain how discrimination against LGBTQI plus people in healthcare settings leads to long-term negative health outcomes?
Thank you. Yes, as I presented in my written testimony, there has been research on the effect of prejudice and discrimination on LGBT people, has been done for decades, recognized by both administrations, Health and Human Services, by the Academy of Sciences. So this is not just me representing my research. And what we've seen also, before I get to your effect of those types of attitudes, that violence, disrespect, bullying for youth is a very common experience for LGBT people. If I may, there has been an equivalency made here in this hearing between attacks on LGBTQ people and, of course, horrible attacks on Christians or other people who are attacked violently, but they're not equivalent. Not to say that one is better or worse than the other, but when you're attacking a group of people in a sense that is embedding and reverberating hatred and stigma that has been going on for decades and are part, as you said just now, of the American system, you are creating a damage that is above and beyond just the attack that the person experiences, and it brings back attacks that they had experienced throughout their whole lives. Being Christian is not a stigmatized position in American society. It is very valued, and it's a good thing. But to be attacked for being Christian has a different nature. Again, not that I am supporting any attack or any discrimination. And what we've seen at these types of attacks, this kind of discrimination, these kinds of bullying, they all have impact on LGBT people, especially in mental health, depression, anxiety, and the very high rates of suicide ideation and suicide attempts that we see both in older generations and in younger people who are LGBT.
Not to cut you off, my time is running out,
I'm
but,
sorry.
and also it's even worse for people of color that
Of
belong
course,
to that
as I
group.
mentioned in my testimony.
My time is running out. I just wanted to say to Mr. Wolf, it is so wonderful to see you again, and I just appreciate your advocacy so much. You came and spoke to a group for me in Chicago, and I have a niece that belongs to the community, and I'm just so glad that there's advocates out there, and I'm a big ally, as Rashida Tlaib said also, and will always be here when you need me. Thank you.
Thank you. I appreciate that.
The gentlewoman from New Mexico